We are really excited to welcome Mr. Dave Thomas to our podcast. Dave has led a very storied career in the health plan space with 25 years spent at both Fidelis and then Centene, rising the ranks from director to CEO of the plan and then CEO of markets and Medicaid for all of Centene Corporation. Really excited to have Dave on and share his experience as a health plan executive to date and kind of where he sees things going in the broader perspective from his perspective. So thank you again, Dave, for joining us today.
Thank you. Good to be here.
So, Dave, you recently completed 25 years with Fidelis and Centene. Can you walk us through your journey there?
Yeah, sure. Well, I'm from New York. Spent my entire life in New York up until 6 or 7 years ago, and went to school in New York, public school, all the way through graduate school. Um, and just developed an interest in healthcare or the business side of healthcare as I was coming up through school. So I decided to go to graduate school for healthcare administration. So I went to Baruch College, got my MBA in healthcare administration, and started off in New York City's on the hospital side. Uh, so did some time at Memorial Sloan Kettering Cancer Center. So I ran some surgical practices at Memorial Sloan Kettering. Uh, and then for a brief period of time, I was in physician practice management back in the late '90s for a couple of years. But ultimately, I've spent most of my time in Medicaid managed care. So I've been in Medicaid managed care since 1999. I joined Fidelis in 1999, and at the time, Fidelis was a very, very small uh, Medicaid managed care plan, less than I think 70,000 members at the time, and not a lot of infrastructure. So they had been using a vendor actually to provide all the back office operations, claims administration, and the like, and had just done an acquisition, and through that acquisition had brought in a bunch of the infrastructure around a health plan, the managed care information system primarily. Uh, so it was really in its infancy, and Medicaid managed care in general was in its infancy at the time. And so, my role was to basically build out the operations of Fidelis to expand, across New York State. I think we were in 21 counties in New York when we started, or when I started. Uh, and ultimately, we were able to expand across the entire state and bring up operations in all 62 counties in New York. And then along the way, also added a number of other government programs, products. So we started off, like I said, in what I would call, mainstream Medicaid managed care, but we expanded into Medicare Advantage uh, with an emphasis on the dually eligible, the folks that are eligible for both Medicaid and Medicare. We ultimately were able to bring up a marketplace product, so the Obamacare, what people call the Obamacare products. We brought those up. We also moved into long-term care and the Medicaid population, the nursing home eligible population. And New York is actually only one of two states that has the basic health plan that was created in the ACA. So uh, Fidelis also became the largest provider of services to the basic health plan members as well. So, over a period of probably 15 years or so, we grew that plan from about, like I said, a little less than 70,000 members to about 1.7 million members by about 2018. Uh, and then we sort of, had to decide what was next. We were at that point the largest government programs plan in the state, and but we were, not for profit. It was a little bit difficult to get to the capital to invest in the business, and you guys know uh, there's constantly technological advancement that you sort of have to keep pace with. That costs a lot of money and resources to really keep pace. So I think we were sort of at the point where we felt like we were going to have difficulty keeping pace. And so we looked for other options, and ultimately, I think we were lucky enough to end up connecting with Centene Corporation. So in July of 2018, we we did a transaction with Centene, and that's when I moved into the Centene universe. So in terms of my career with Fidelis, it was really, everything: building out the operations, expanding the network, bringing new products up, and really growing the plan both geographically and in terms of membership, and diversifying our offerings in terms of products. So we became, I think, pretty much a comprehensive solution for government programs. And then we moved into the Centene universe, I think, pretty seamlessly. So I had spent most of my time at Centene as the chief operating officer. My last couple of years at Centene, I moved into the president role. And so I came into the Centene universe as the president of Fidelis Care, which is the New York market for Centene. And I did that for a little over a year, between probably a year and a half. And then in 2019, my boss at the time decided to retire out, and so I moved into the role of CEO, Medicaid and Markets at Centene, and that really is just running the Centene Health Plan division. So big step up for me in terms of my career and in terms of the breadth of responsibility. So I moved from managing a single plan to overseeing 32 health plans ultimately across 31 states. In that role with Centene, and I think really enjoyed the time doing that. Really expanded my career, and I think my capabilities in a lot of ways. Lots of challenges, pandemic, a significant amount of new business, retaining old business, winning new business, some mergers and acquisition activities, trying to assimilate, acquired entities into the health plan division. So, just a lot of good experience for me. And we were able to, I think, continue to improve quality and overall performance while, continuing to expand the business. Again, both in terms of geography and also membership and product line diversification. So, I did that for a little over 5 years. So from October of 19 to December of 2024. And then I decided to, retire out from that role. And since that time, I've been doing some advisory work with a company that's doing some startups, and that's also been really interesting, and I think has continued to expand my knowledge base.
That's awesome to hear, Dave. And you touch upon a couple of things that I want to go into, and we want to go into a little deeper. But the first thing is the expansion of Fidelis itself and how you guys grew over that course of time. That's really tremendous growth, not only in the breadth of services, but the actual just sheer number of lives covered. What was key to driving that growth? Like, how did you guys do that? And for those who don't know about Medicaid expansion in general, how do Medicaid plans actually go about growing business? What's the best way to do that?
Yeah, well, Medicaid is interesting. It differs a lot by state. New York is unique in that in New York, they have something called facilitated enrollment, where the plans are actually able to enroll members, to assist members in getting enrolled, so understanding their, the potential benefits and that kind of thing. So there's more, I would say, face-to-face interaction in New York with the Medicaid population. Some states, most states, you don't have any of that. Members are given a choice in most states, and if they don't make a choice, they get auto-assigned. That is true in New York as well, but like I said, in New York, there's also this outreach function. So that made growing the plan easier, because you were able to actually interact with potential members, explain, help them to get enrolled in Medicaid, and then ultimately, make a decision about what plan to join. So that certainly is helpful. But I would say the biggest thing is really the provider network. I mean, at the end of the day, members join a plan because of the provider, not necessarily because of the payer. I mean, the payer certainly having a good experience with the payer is a big benefit, but it really is the providers that drive growth, particularly in the Medicaid business. And so I think that the thing that I think that we did in New York is that we developed really good provider relationships, and I think we're known as being a good partner. There's always a certain amount of tension that you're going to have between a payer and a provider, but I think we really focused a lot on trying to provide a high level of service, to pay claims correctly and quickly, to help with quality initiatives, and just really be as responsive as possible to the provider network. And I think through that, we generated a lot of good word of mouth among the Medicaid population and the providers that serve the Medicaid population. And so I think, again, we were considered to be, a good partner. And that enabled us to both grow the existing membership in the areas that we were already in, but it also allowed us to build our provider network in, geographic areas that we weren't in yet because we had a good reputation. And, if providers are not willing to sign a contract with you, then you've got obviously big problems because, what are people actually enrolling for at that point? So I think that was probably the big thing is just really trying to foster good relationship between us as a payer and the providers. And that was what allowed us to do the geographic expansion and to sort of organically grow our products, once we were in a geography.
Over those 25 years, you must have learned thousands of pearls along the way. What are some things you wish you knew, you know, back in '99 when you got started?
Oh, boy, that's a good question. I think that Medicaid is a complicated business, and it varies a lot, not just by state, but it really varies a lot by region within a state. And I think probably would have been helpful to realize that, you know, going in that you really had to, spend the time to really understand, local communities, both on the healthcare delivery side, but on the member side as well, because there is so much difference in, some things that, are perfectly fine, in one county or in one region, don't fly in others. There are, I think try to, as a payer, your natural inclination is to try to standardize where possible, just because it's more efficient and it's, sort of easier to manage. And I do think that's important, but I think particularly in Medicaid, you have to understand that there are a lot of nuances. Like I said, there's nuances by state. There's nuances by region within a state, and really, I think the faster you realize that, and the faster you sort of take that into account in terms of your thinking and what you're trying to learn, the better off you are, and the more agile that makes you, and the more responsive, and I think that's what really facilitates success.
How did you do that at scale? I understand, in the beginning you had specific counties, but then those number of counties grew, and now you have to cover so many plans across so many states. How can you be
Yeah,
attentive to all those needs?
yeah, I think you got to structure things, you know, the best way possible, and I always say, like, all of us are only as good as the people that we work with. If the people that we work with are not talented and committed, then you're not going to have success. But I think specifically, my experience in New York is we really invested a lot in provider relations and in our provider relations representatives. And, sometimes there's an inclination, I think, among payers that, hey, the most efficient way to do things is to do things telephonically. It's lower cost, you can cover more ground. But I've always felt like it's very important in provider relations to have face-to-face contact with providers and to, really sit down with them on a regular basis and, understand what their experience of you as a payer is, because, you may think they're having a particular experience, but you don't really know until you actually sit down and have I think a face-to-face conversation and really understand it. And not just the provider reps, but also, the leadership. I think it's also important to get out there and really listen to folks. And you're not always going to agree on everything. I mean, I don't think I'm telling anybody there that anything that they don't know. But I think that's, if you want to call it the secret sauce of, I think, what Fidelis did in New York that was really successful. I think that was the biggest part of it was, the commitment to having people out in the field in, every county, every community that we were in. And then I think having a good structure for, having that information communicated back to where we could actually take an action based on it. Because it's one thing for people to, be out and listening. But it's another thing to actually be able to take the information that is coming out of those meetings and actually figuring out, okay, well, what do we do with that? What's the strategy? Because I've always felt like probably the worst thing you can do is to go out and talk to folks and hear what they have to say and commit to, being responsive and then to not be responsive. That's almost worse than just, because you've sort of made a commitment that I'm going to do something here. I'm going to, make an attempt to, straighten out an issue or something like that. And then if you don't do it, it's almost worse than not having the conversation in the first place. So I think we built a very, very good structure for getting out, hearing what was going on, and then actually having a good mechanism for taking that information and turning it into, actionable, something that we could take action on.
And, speaking of kind of some of that commitment you had to the provider side, having dividends, like obviously you had a 25-year career at Centene. Well, Fidelis and Centene both. And so what's fascinating to me is that that is, I would imagine you've probably seen as well, it's really uncommon, right? It's actually getting more and more uncommon. Even as a surgeon, it used to be you would stay at one place for a long time, but now people are moving a lot faster. And what I want to know is what actually kept you connected to Fidelis and Centene for that period of time, because there's a lot of health plan leaders that are listening to this podcast or watching this podcast and maybe thinking about their own trajectory, their plan and organization. So what kept you with the organization for so long?
Yeah, I mean, that's a good question. And, for somebody who is on the sort of the administration side, I would say it really is growth. I mean, what kept me at Fidelis as long as I was there was just the opportunity to grow and learn and get involved in new things. I was always somebody that, was ambitious and motivated and wanted to, wanted to have a career and move up in a career. So it's a combination of, opportunity. I would not have stayed at Fidelis as long as I did if I came into Fidelis in a role and then there was never an opportunity to move on to a different role with more responsibility and, maybe a broader span of responsibility. So, part of it was, just the fact that the organization was growing and diversifying created a lot of opportunity for somebody like me. And I sort of felt like I believed in what we were doing from a mission perspective. And as long as I was growing and my career was advancing, I was very happy to stay where I was. I didn't feel the need to move. And I think that goes for a lot of people. If you see opportunity, if you're growing, you're more likely to stay, obviously, than if you feel like your career is stagnating. And that's why I also stayed at Centene, I think, as long as I did, after we did the transaction, was that, within a year and a half, I had a new opportunity to continue to grow my career, learn new things. And then in the role, we were, constantly, you know, bringing, new plans on board, or starting new business, or reprocuring existing business. And there was more than enough to sort of keep me engaged and feeling like I was continuing to learn new things. So I think I've been lucky in my career that I was able to, you know, like I said, to, continue to evolve and mature in one organization as long as I did, rather than feeling like, hey, I feel like I'm stagnating and I need to make a change.
You talked about all the roles that opened up, and what do you think was responsible for you being able to be chosen for all those roles? To continue to grow along the way. What's your secret to success?
Yeah. I mean, I think for me, it was always, I think I always had a certain talent for, sort of being able to get from point A to point B, to sort of like assess the situation, figure out, what are the, five or six things that, I need to make sure these things happen in order for us to get to, whatever result we're trying to get to. So I think I was identified pretty early on as somebody who could get things done. And and again, and that is, I think, a skill, to not just be able to sort of assess, a situation, but to figure out, okay, well, this is the result that we want as an organization. How do I get everybody sort of corralled and moving in the right direction to achieve that? And so that goes with things like, expanding geographically, bringing new product lines on, heading up cost savings initiatives. I think that was probably the biggest thing for me, is just developing a talent for being able to take a team, sort of, get it to coalesce and, understand what needed to happen, and then to be able to sort of, manage our way forward.
That theme of getting things done, I think, I saw a video. It was an interview with President Obama, and I don't know if it was when he was in office or after office, but and I think it was him. And in this interview, and they asked what the key to success was, and he said, just get stuff done.
Yeah.
And now on the flip side of that, working for a large corporation, first Fidelis and then Centene, which is a big public company, no doubt you probably had many times where you wanted to get something done, but there are plenty of roadblocks or institutional hurdles or organizational red tape. What advice do you give for those who are dealing with that red tape when you have to balance thinking outside the box versus staying within certain lanes? Like, how did you actually navigate that? Because I'm sure that happened a lot.
Yeah, I mean, I think a couple of things. I mean, one is, you have to decide, not just by yourself, but with your colleagues, like, what are the priorities? Because I think what sometimes happens, particularly in large organizations, is there's so many priorities, there's so many things that need to be improved or addressed or whatever. And if if you don't sort of narrow that down to something that's manageable, then you don't get anything done, because you're constantly jumping from one thing to another. So I think part of it is the ability to sort of, look at all the competing priorities and deciding, all right, which ones are going to move the needle the most. I can't do them all, so which ones are going to, move the needle the most, and let's focus on those. So that's certainly one thing. The other is to try to, you're absolutely right. In different organizations, there are different, obstacles that have to be overcome and that kind of thing. I think part of it is like sort of not giving into the frustration of that, and looking at it as a challenge to say, this is the result that we're trying to get to. This is the objective. I personally think there's an easier way to do it, but that way is not available to me. And so, I'm going to take it as a challenge, sort of, to figure out, how can I overcome these obstacles to get to that objective. So because getting, I think a lot of times sort of getting frustrated about things and sort of like letting that consume you is not productive. There generally is a way, I've always found, in any organization to, to get to the objective that you need to get to. But a lot of times it requires a certain amount of creativity to figure out how to do that within the parameters that you have to do it within.
So as you navigated, I'm sure along the way you became a mentor to all kinds of folks. But who were some of the key mentors that you had, either early on or middle, or certainly even later on in that progression, that really helped guide you not only on the organization, but how to be a health plan leader to begin with?
Yeah, I mean, there's certainly been a lot of folks, probably, too many to, to mention. But I would say that, there was two people in particular at Fidelis. There was a guy named Mark Lane, who was the CEO at Fidelis when I started. He had moved over from the hospital side and was in Fidelis in the very, very early stages. And then there was his number two was a guy named, he is a priest named Patrick Frawley. So Mark was the CEO. Patrick was, or Pat was the COO. And I learned a lot from them about just sort of, perseverance, because in the early days of Fidelis, it's a whole story, but in the early days of Fidelis, there was many, many obstacles. It was a Catholic sponsored organization. It had a sort of a very interesting relationship with the Catholic hospitals. They were definitely partners in the enterprise, but they also had very, specific feelings about how things should work. And again, managed care was very much in its infancy. And I think, a lot of people probably would have moved on if they had sort of faced the obstacles that those two guys faced, but they stuck with it and built a plan. Like I said, a very large plan over a period of time by, being very tenacious and, really figuring out, okay, again, what are the priorities, and not just in terms of what are our priorities in terms of objectives, but, what relationships are really important, to a managed care plan. And I think one of the things that they identified was, which seems, maybe obvious these days, but I think at the beginning it wasn't as obvious, was regulator relationships. We have to have good regulator relationships. At the end of the day, the regulators are the client. The contract is with the state and Medicaid, and you really have to manage those relationships. Try to help set expectations, meet expectations, and those have to be priorities. But I think those two guys, I think, were the ones that were most responsible for me to sort of develop the way I approach things. I think a very I try to be methodical and pragmatic. And again, trying to weed out a lot of the noise and just figure out, okay, this is the objective. What are the 5 or 6 things that are going to get me to that objective, and try to focus on those things and separate out the noise. Those guys did that under a lot of pressure in the early days, and I think watching them do that is a big reason that I've been able to have the career that I've had.
And you have so much to offer from an advising and mentorship perspective. So how do you balance things like perseverance and getting things done with the other concepts such as burnout and work-life balance?
Yeah. Yeah, I mean, that's a big issue. It can be a big issue. Some of that is, an individual person's, personality. Um, what do they enjoy doing? What do they not enjoy doing? But I think for me, again, I try to, it's not a simple business. There are a lot of complexities. there's constantly things that you're reacting to. And I think what stresses people out, in my experience anyway, is when they feel like they're just putting out fires every day. They're putting out fires every day and they're not making any forward progress. I mean, my experience is most people, I mean, don't mind working hard. I mean, they want to work hard. They just want to see results from the hard work. And I think the burnout comes from feeling like you're doing a lot of hard work, but you're like sort of a hamster on a wheel. You're working really hard and you're not getting anywhere. So again, that's where I go back to, I always have felt like probably one of my biggest roles as a leader is to help people work through that. And again, to try to get them to simplify things as much as possible and not try to do everything at one time. And, you know, and, you know, set a reasonable number of priorities that they're going to pursue. And on some level, realizing that that's going to mean that not everything gets done when you would like it to get done or in the way that you would like it to get done. And on some level, you got to be okay with that, particularly if you're in operations, because, operations is a complicated, it's a complicated business, and there's always going to be things that are not working the way that you want them to work. And you can't fix them all at the same time. And you're never going to get to a point where everything works the way it's supposed to work all of the time. And so, again, you have to concentrate on focusing on the things that are going to move the needle the most, that are going to, provide the biggest boost to provider satisfaction, member satisfaction, regulator satisfaction, growth, financial performance, whatever the objective is. You got to sort of be able to focus on the things that are going to move those needles the most and not ignore the other stuff, but realize that you're not going to be able to manage all of that, all the time the way that you would like it to be. And you got to be okay with that and keep your focus on the big picture.
Awesome. And I think we have time for one more question. This is great, Dave. And we have time for one more question. Mel, you kick off the final question as we wrap things up.
Sure. As you look back on your career so far, what are you most proud of and what excites you about the next steps of your journey?
Yeah, I think the thing I'm most proud of is the success of Medicaid managed care. In my view, when you take a step back and really look at it, I think it's an incredible story myself. I mean, you've increased access to care dramatically from where it was before Medicaid managed care, in my view. And you've done that at the same time that you've improved the quality of service that's being provided to the members and the quality outcome for those members. When you look at where things were, in the 80s with the Medicaid population, real significant issues with access and real significant issues with just quality outcomes. The quality outcomes for the Medicaid population used to be dramatically worse than commercial populations, and that gap has been closed a lot, and in some cases, I think closed entirely. And so that is a huge accomplishment for Medicaid managed care in general, and I think for those of us who built plans like Fidelis in particular. And the other thing I would say is a major accomplishment is that when we made the decision to do the transaction with Centene, what came out of that was a foundation in New York called the Mother Cabrini Foundation, which is one of the biggest healthcare focused foundations in the country at this point. So, and they do a lot of good work in New York. Facilitating access to care, improving quality of care, and just doing a lot of really good work in New York around healthcare. And if that foundation is managed competently, which I think it will be, that'll be, they'll be giving out grants and facilitating improvement for decades to come. So I would say those were the two biggest accomplishments in my career so far.
And what do you look forward to in the next step in your career?
Well, I mean, at some point I would love to get back to back into health plans and running health plans. It's what I really like to do. I think there's still work to be done. Like I said, there's been a lot of success, but I think there's still a lot of work to be done in terms of continuing to drive access, drive improvement to quality, drive satisfaction. And ultimately, I think I'd really like to get back to doing that.
Awesome. Well, thank you so much, Dave. This was awesome.